Hello everyone, welcome back to our AMC 1 preparation series. In this video, we'll be diving into the topic of dyslipidemia. So, let's get started without further delay. Dyslipidemia. Pretty much we're thinking about hypercholesterolemia. Dyslipidemia is considered when your blood has too much bad cholesterol, that is LDL, and low HDL level less than 1 millimole per liter, or high triglycerides, which can raise your risk of heart problems. Dyslipidemia can be primary or secondary. Genetic or familial hypercholesterolemia is a most common primary cause, whereas conditions like hypothyroidism, uncontrolled diabetes, obesity, excess alcohol, liver disease, or drugs like beta blockers, diuretics can cause secondary dyslipidemia. The RACGP guidelines emphasize assessing cardiovascular risk assessment every 2 years, especially in patients aged more than 45 years and more than 35 years for Aboriginal or Torres Strait Islander individuals. We start the patient with non-pharmacological therapy. Lifestyle modification are the initial management plan for this patients, like diet, weight management, everyday exercise, and no alcohol, no smoking. We will reassess patient after 6-8 weeks, and if that doesn't work, then we go into pharmacological measures. In pharmacological therapy, statins like atorvastatin, rosuvastatin is first-line drug for dyslipidemia. We have fibrates, ezetimibe A, niacin, and bile acid resins. But the most important question here you will get is what is the first line of therapy in a patient with dyslipidemia? And it's always going to be lifestyle modification or non-pharmacological measures. I have not seen any questions where they do ask about dyslipidemia medications and side effects. I don't think it's too important, but it's always good to read up on it. Remember that statins are unsafe during pregnancy, so they should be avoided in pregnancy, and the increased cholesterol level associated with pregnancy subsides after delivery. So no drugs needed. One more thing. Triglycerides level more than 10 millimole per liter increase risk of pancreatitis, so screening test must be done in this patient. That's everything you need to know about dyslipidemia. Keep in mind that lifestyle modification is the cornerstone of its initial management. Join me in the next video, where we'll explore another cardiology topic. I'll continue posting video lectures for the AMC 1 prep series to save you from sifting through extensive guidelines. So, please like, share, and subscribe.